So, hi there, this is Diane back with you, and I do hope that you watched the first segment to this series of videos that we're discussing on the topic of suicide. And uh, the latter, the end of this set of videos, we'll be talking of some wellness techniques. So, I want to speak to a bit about the barriers or the stigma of getting mental health treatment. Uh, as long as I've been in this field, people have addressed the issue of stigma. So it's been around, it's better, I think, but it hasn't gone away. And I think it definitely has not gone away in regards to persons who are in the medical profession, be that physicians, nurses, practitioners, psychologists, counselors. Um, I think we all, in our positions, still have some stigma to attend to. And I just want to take this from a basic level. You know, we know that mental illness is a common experience. We should not be ashamed of that, although I think oftentimes we are. Um, Studies have shown that 1 in 5 American adults experience some kind of mental illness during a period of a year's time. Half of Americans, 50%, experience mental illness sometime during their lives, and about 5% of adults are currently living with a serious mental illness. So, I think as I say those things out loud and I hear myself say them, so why do we think we're exempt? Why are we professionals exempt from mental illness? Well, the bottom line is we aren't. We're those adults. And consequently, I think we need to address the stigma and barriers and what are some things we can do about those barriers. So there was a Medscape survey I read from March 2021. I know these are a couple years, but we've been in challenging times and there aren't as many studies yet published. But a Medscape survey 2021 surveyed 13,000 physicians in 29 specialties. So that covered quite a range of providers. And I was staggered by some of these results. Of those 13,000, 4% preferred not to answer the questions. So there goes your stigma or risk involvement in owning your life experience. 1 in 10 physicians considered a suicide. 1 in 10 physicians considered a suicide attempt in 2021. 1 in 10. 20% of those reported feeling depressed. 20% of those 13,000. This staggered me. 24% of those surveyed said they were experiencing clinical depression. So a level of depression that they were concerned about. Certainly, when you think about 1 in 10 of those considered a suicide attempt, that's quite serious to me. So we need to be aware. We need to be receptive to where people are. We need to be receptive and owning of where we are, irregardless of our position in our professions. And it's very important. Some of the driving factors I mentioned in the previous was messaging and inboxing. The challenges of having a daily patient load and one patient after the another and one booked every 10 to 15 minutes, and then having this influx at some point in that day of messages to be returned, lab results to be looked at, responses to people's needs. And I think oftentimes those are not accounted for in the workday. There just isn't time designated for those things. And I think that's something that administrative uh, powers that be could look at and address and need to be, just for the psychological well being of the workforce. So the driving factors include that high workload, um, many challenging patients, relationships you have to those patients are important. And and again, I want to refer back to that concept that I think as providers we often see ourselves as needing to project this sense of perfection. We cannot have a problem. We feel like it. We're we're very independent sort of people. We feel like we have to portray this sense of I got it all together. Well, in reality, no matter what hangs on our wall as far as credentials, we are still a human being. And as humans, we are vulnerable. Life can take a turn. We never know when, how, where, but in an instant, our lives can change. And I think we know that at some level, but we think, oh, I cannot let anyone know how vulnerable I feel sometimes. And I think that's a mistake. I think that's a mistake we professionals make. Another driving factor, I think, to some of this stigma and this barrier to us seeking assistance or seeking help that we need is just fear of our careers. I know in the field of psychology, we renew our license every 3 years. And one of the questions on there is, do you have any mental illness? Have you been diagnosed with any mental illness that would interfere with your ability to perform the task of your job? Who's going to say yes to that? You know, mm, I don't know that we lie necessarily, but we certainly oftentimes, I think that's one of the reasons people don't, is because fear of those licensing boards and restrictions to um, our practices are certainly. So, we kind of have that oversight that says you can't be vulnerable. You can't you can't be sick. Well, bottom line, look at the numbers. 1 in 5 Americans. Who is that? Basically that means 1 of 5 people you come across during the day has had some sort of mental turmoil, if you call it illness, mental distress this past year, or they're going through it now. So, we are not, we do not live in a bubble, and we are not able to avoid the presence of mental distress because we are human beings. So, I want to encourage you as providers, as physicians, please, please find a way not to, please find a way to address that stigma for you. Whatever is the source of your reluctance, if you have a need, address what is your particular source of resistance to seeking the help that you need. And I want you to just think of those think of those stigmas, think of the barriers, and talk with someone about those if you're willing to do so.